what we have learned in the last 8 or 9 years in doing high content, high throughput molecular characterization of tumors is that while there are certain alterations which may be found in more than one tumor type, there are other changes which are very much cancer specific, and which means that we do not know what all the changes are in Burkitt lymphoma. This tumor was molecularly characterized already in the 80s with much cruder methods than what we are using today. And this was a one tumor where we saw this interesting chromosomal aberration. There was lots of effort done in trying to understand what's happening with this translocation, what are the genes which were involved. We have designed the study, and we are in contact with doctors and institutions in Africa so that we can study the endemic. We are in contact with every institution that we know treat Burkitt lymphoma cases in the United States, pediatric as well as adult. And we are also collecting tissues, or going to collect tissues in Brazil. We are going to be looking at endemic Burkitt lymphoma, which is HPV-associated sporadic Burkitt lymphoma. That means that there is no family history of Burkitt lymphoma, as well as the HIV associated. Everybody is interested in identifying what the changes are, because that can then also help us at the diagnostic stage. If you don't have the right diagnosis, the treatment then is not specific and the outcome is poor. They have been our collaborators in identifying the cases and the clinical data, because all of these molecular characterization wouldn't be good enough if we didn't have the clinical data, how the patients were treated, what was the outcome. I see that Burkitt lymphoma, as well as other investigators around the world, will be taking the data that we generate and the conclusions that we draw and take it the next step, which is to develop clinical trials that the foundation could potentially in the future be leading some of that work, in addition to other institutions like the NCI, who has a whole division dealing with clinical trials. But anything that could be facilitated to bring the findings into the clinic to benefit the patients, I see that the foundation would have a role.